Polycystic ovarian syndrome is a complex endocrine condition affecting 5% to 10% of women of the childbearing age group. The incidence of PCOS is on a rise because of the current lifestyle and stress. Having polycystic ovaries on the ultrasound does not mean having PCOS. To diagnose PCOS, two out of the following three conditions are required. Number one, missed periods, irregular or infrequent period cycle. Number two, excess of facial or body hair growth and or blood test suggestive of higher testosterone levels more than normal. 3. An ultrasound scan suggestive of polycystic ovaries. PCOS can present with spectrum of clinical presentation which can affect menstrual periods, fertility, physical appearance. Common symptoms include irregular menstrual cycle, excess of facial hair growth or abnormal hair growth on the chest, stomach or the back, acne or oily skin, thinning of hair or male pattern baldness, obesity, weight gain, infertility, acanthosis nigricans, that is, darkening of skin behind the nape of the neck, armpits, and under the breast. PCOS is associated with obesity and increased insulin resistance, and therefore they are at risk of developing diabetes, gestational diabetes, that is, diabetes during pregnancy, hypertension, and heart disease. Women with PCOS are also at risk of developing endometrial cancer. This is the cancer of the lining of the womb. They are more likely to be diagnosed with various mental health conditions like depression, anxiety, and mood swings. And they are also at risk of obstructive sleep apnea and excessive daytime sleepiness. There are four subtypes of PCOS. The first one is the insulin resistance PCOS. This is far more the most common type of PCOS. High insulin levels is caused due to high sugars, smoking, pollution, and trans fat. High insulin level inhibits ovulation and triggers the ovaries to produce testosterone. The second type of the PCOS is caused by the pill. It is called the pill-induced PCOS. Birth control pills prevent ovulation. In most of the women, these effects revert back to normal once they stop taking the pills. However, in some women, for many months and years, they do not start ovulating again. These women need to see a doctor during this period. The third type of the PCOS is the inflammatory PCOS. In PCOS, due to inflammation, ovulation is prevented, androgen levels are very high, and hormones are imbalanced. Inflammation can be due to stress, toxins in the environment, and due to foods like gluten. The fourth type of PCOS is the hidden PCOS. In this is the most simple type of PCOS. Once the cause of PCOS is addressed, like thyroid disorder, zinc deficiency, iodine deficiency, or artificial sweeteners, the effect goes away and women do start ovulating. Lifestyle changes, diet and exercise are the first line in the management of PCOS. Diet and exercise targeted for weight reduction reduces the insulin and androgen level. Even a modest reduction in the weight, for example, losing 5% of the body weight, can be beneficial. Complex carbohydrate foods like peas, lentils, quinoa, and high fiber diets, fruits and vegetables increases the blood sugar level more slowly and should be incorporated into the PCOS diet. Simple carbohydrates like breakfast cereals should be eliminated or completely avoided from the diet. Exercises like walking, yoga, Pilates, Tai Chi, cardio, and strength training are some of the best forms for the PCOS. Something as simple as walking 20 to 30 minutes after each meal may be beneficial. High intensity interval training or HIIT may be helpful in some as it helps in fat burning and weight loss. However, there's no ideal regimen for a PCOS patient and it should be individualized. It's always a good idea to talk to a personal trainer if you haven't exercised in a while or you're not in the best body shape.